Hello, I'm Dr. John Howard, Director of the National Institute for Occupational Safety and Health and the Administrator of the World Trade Center Health Program. The World Trade Center Health Program was created by the James Zadroga 9/11 Health and Compensation Act of 2010 and is authorized through 2090. There is no deadline for applying to the World Trade Center Health Program. The program provides no-cost medical monitoring and treatment for certified World Trade Center-related health conditions to those directly affected by the 9/11 attacks in New York, at the Pentagon, and at Shanksville, Pennsylvania. These benefits are available to enrolled responders and survivors regardless of where they currently reside. Currently, the program serves 9/11 survivor and responder members in every state in the country. Almost 2 decades later, the World Trade Center Health Program has enrolled more than 110,000 responders and survivors, tens of thousands of whom still suffer physical and mental illness arising from their 9/11 exposures. The World Trade Center Health Program is pleased to provide medical care to the responders and survivors of 9/11. If you are a 9/11 responder or survivor, but you are not currently enrolled in the World Trade Center Health Program, please visit our website or call the number on the screen for more information on how to apply. Today and every day, we will never forget.
What is the difference between the World Trade Center Health Program and the September 11th Victim Compensation Fund? It is very important for everyone who may be eligible to understand that the WTC Health Program and the September 11th Victim Compensation Fund, or VCF, are 2 separate programs. Each program has its own enrollment process, eligibility criteria, and mission. That said, the programs work closely together in many ways, and the VCF relies on WTC Health Program certification of WTC-related physical health conditions when reviewing VCF claims. While the WTC Health Program is administered by the U.S. Department of Health and Human Services and provides medical monitoring and treatment for eligible responders and survivors, the VCF is administered by the U.S. Department of Justice and provides financial compensation for those who have been diagnosed with an eligible WTC-related physical illness and who meet the VCF's eligibility criteria. Enrollment in the WTC Health Program does not register you with the VCF or file a claim on your behalf, and the reverse is also true. Registering with the VCF does not enroll you in the WTC Health Program. It is recommended that you first apply to the WTC Health Program. If you are found eligible by the WTC Health Program and enrolled, you may seek certification for a WTC-related health condition. Once you are certified, you can receive treatment for that condition at no cost to you. If you are certified with a physical WTC-related health condition, then you can file a claim with the VCF for financial compensation. Are you eligible for the World Trade Center Health Program? There is a common misperception that the WTC Health Program is only for first responders. This is not true. There are 2 categories of people that are covered and can enroll in the program and get its benefits: responders and survivors. Eligible responders include those who responded to the WTC in New York City, the Pentagon, and the Shanksville, Pennsylvania crash site. These are workers or volunteers who provided rescue, recovery, debris cleanup, and related support services on or in the aftermath of the September 11, 2001 attacks for certain minimum amounts of time during the period between September 11, 2001 and July 31, 2002. There are 3 types of responders: FDNY responders and WTC general responders, including NYPD, and the Pentagon and Shanksville responders. Survivors are individuals who were present in the New York City disaster area in the dust or dust cloud on September 11, 2001, or who worked, resided, or attended school, childcare, or adult daycare in the New York City disaster area in the weeks and months following the attacks for minimum amounts of time. In general, from September 11, 2001 to July 31, 2002. You do not need to currently live in the New York metropolitan area to receive treatment. This is a nationwide program. You can join the program if you are in the New York metropolitan area or if you live anywhere in the country. There are responders and survivors in the program from every state in the nation. What does the World Trade Center Health Program cover? The WTC Health Program will provide and pay for medically necessary treatment of certified WTC-related health conditions, as well as medically associated health conditions and medical monitoring. What does that mean? It means that once you are enrolled, you will need to see a program-affiliated provider to determine if you have one of these covered conditions and if you meet the program's exposure criteria and onset of symptoms or diagnosis criteria. If a program-affiliated provider determines you meet the necessary criteria, the provider will submit a certification request to the program. Upon receipt, the program will review the provider's request and decide if your condition should be certified. If your health condition is certified by the program will pay for and provide medically necessary treatment for the certified health condition through its affiliated providers. Where applicable, the program is required by law to coordinate recoupment or reimbursement from other payers, such as workers' compensation, and for survivors, from public and private insurers. Members must access services through program-affiliated providers in order for the program to cover any co-payments, deductibles, or other out-of-pocket expenses for medically necessary treatment of certified WTC-related or medically associated health conditions. If you receive medical care for a certified health condition through a non-affiliated provider, the WTC Health Program does not have the legal authority to reimburse you for any expense you incurred. The covered conditions are acute traumatic injuries, such as burns, fractures, and head trauma that occurred immediately after exposure to 9/11 related hazards or adverse conditions. Airway and digestive disorders, also known as aerodigestive disorders, that affect your breathing or upper digestive tract, such as asthma, chronic cough syndrome, gastroesophageal reflux disorder, and sleep apnea. Cancers that make it difficult for the body to function normally, such as lymphoma, leukemia, breast cancer, prostate cancer, melanoma, and thyroid cancer. Mental health conditions that affect your mood, thinking, and behavior, like depression, post-traumatic stress disorder, and substance use disorder. Musculoskeletal disorders are chronic or recurring disorders of the musculoskeletal system caused by heavy lifting or repetitive strain on the joints, like carpal tunnel syndrome and low back pain. By law, musculoskeletal disorders are limited to responders to the New York City disaster area. Once enrolled by the World Trade Center Health Program, where can I get treatment? The WTC Health Program has multiple clinics throughout the New York metropolitan area. There are specific clinical centers of excellence or clinical centers for responders and survivors. In addition, there is a nationwide provider network that provides care for members who reside outside of the New York metropolitan area. Once you are enrolled in the WTC Health Program, you will need to visit a program-affiliated provider for your initial health evaluation, annual monitoring exams, and any care necessary to treat your WTC-related conditions. Monitoring exams are available to all responders and those survivors who are certified with a WTC-related health condition. New members will receive a welcome letter with information on how to schedule an initial health evaluation at one of the program's clinical centers or through the nationwide provider network. How does the World Trade Center Health Program handle responders? How do they get services? And how are they eligible? An eligible responder is an individual who worked or volunteered at the WTC disaster site in rescue, recovery, demolition, debris cleanup, or related support services in Lower Manhattan, south of Canal Street, at the Staten Island landfill, or on certain barge loading piers. This includes members of the FDNY, including EMTs and paramedics, and other fire departments that responded, members of the NYPD, Port Authority Police Department, and other police units that responded, members of the NYC Department of Sanitation, Transportation, and other city, state, and federal entities that responded, including the National Guard and FEMA, workers in the Port Authority Trans-Hudson Corporation Tunnel, vehicle maintenance workers who were exposed to debris from the former WTC while retrieving, driving, cleaning, repairing, and maintaining vehicles contaminated by the dust from the 9/11 attacks. Individuals from the building trades, construction, telecommunication, and utilities, day laborers, and volunteers who worked on the pile and the surrounding area. News crews, journalists, and members of the media who covered the WTC disaster. Employees of or other morgue workers who performed work for the Chief Medical Examiner of NYC involved in handling remains from the attacks. Finally, volunteers who, either as part of an organization like the Red Cross or on their own, performed rescue, recovery, or cleanup, or who provided related support services such as cooking or providing meals to other responders, providing emotional and administrative support to residents and rescue workers, are considered responders and should apply as a responder. In order to be eligible, all individuals must meet specific activity, location, time period, and hour requirements. The Responder Program is a monitoring and treatment program. Therefore, you do not need to be ill or have a WTC-related condition to enroll. If you are not sick, you will continue to be monitored for WTC-related symptoms and conditions, such as asthma, cough, shortness of breath, sinus congestion, GERD, stomach problems, anxiety, depression, and PTSD. Many cancers are also covered for monitoring and treatment as well. The Responder Program provides all monitoring and treatment at no cost to responder members. Once you are evaluated and annually monitored, any WTC-related physical or mental health condition will be submitted to the WTC Health Program for certification consideration. If your condition is certified by the program, it will be treated. Neither you nor your insurance will be billed for services provided to you by the WTC Health Program. However, if you have an established workers' compensation claim for your certified WTC-related health condition, the program will recoup costs from workers' compensation carriers for medically necessary treatment provided by the program. Benefits for responders in the WTC Health Program are provided through Clinical Centers of Excellence, clinical centers in New York and New Jersey, and through a nationwide provider network for those residing elsewhere in the U.S., including Puerto Rico and other territories. FDNY responders, active or retired, can receive monitoring exams and treatment through the FDNY WTC Health Program clinical centers, with clinics in New York City, Long Island, and Orange County. All other responders to the WTC disaster, also known as general responders, can receive monitoring exams and treatment at clinical centers in Manhattan, Queens, Staten Island, Long Island, and New Jersey. For those responders living outside of the New York metropolitan area, The WTC Health Program provides care via its nationwide provider network. For an application to enroll in the Responder program, please visit the program's website. You can also call 1-888-982-4748 for an application and any additional information or assistance you may need. How does the World Trade Center Health Program handle survivors? How do they get services? And how are they eligible? You are eligible as a survivor if you were present in the New York City disaster area in the dust or the dust cloud on September 11, 2001. The disaster area is anywhere south of Houston Street in Manhattan and any area of northwestern Brooklyn within 1.5 miles from the World Trade Center site. Or if you worked, lived, or attended school, childcare, or adult daycare in the New York City disaster area for at least 4 days during the 4-month period from September 11, 2001 to January 10, 2002, or 30 days during the 11-month period from September 11, 2001 to July 31, 2002. Or if you worked as a cleanup worker or performed maintenance work at the New York City disaster area during the 4 months starting September 11, 2001 and ending on January 10, 2002. Or if you lived in the New York City disaster area during the time between September 11, 2001 and May 31, 2003 and deemed eligible to receive a residential grant from the Lower Manhattan Development Corporation. Or if your place of employment any time during the period beginning on September 11, 2001 and ending on May 31, 2003 was in the New York City disaster area and was deemed eligible to receive a grant from the LMDC or other government incentive program designed to revitalize the Lower Manhattan economy after the September 11, 2001 terrorist attacks. The Survivor Program is a treatment program. In order to enroll as a survivor, you must have at least one symptom or diagnosis of a WTC-related physical or mental health condition. The most common symptoms or conditions are asthma, cough, shortness of breath, sinus congestion, GERD, stomach problems, cancer, anxiety, depression, and PTSD. If eligible, survivors are enrolled as screening-eligible survivors, but become certified eligible survivors if their initial health evaluation results in being certified with at least one WTC-related health condition. The program provides physical and mental health treatment for WTC-related health conditions, annual monitoring exams for certified eligible survivors only, certain cancer screening, and benefits counseling. For those who live in the New York metropolitan area, services are provided through 2 clinical centers of excellence, or clinical centers. One clinical center through the NYC Health and Hospitals WTC Environmental Health Center, which has 3 clinic locations in Manhattan, Queens, at the Bellevue, Elmhurst, and Gouverneur Hospital facilities. The second Survivor Clinical Center is located on William Street in Lower Manhattan. For those survivors who reside outside the New York metropolitan area, there is a nationwide provider network to treat members across the U.S. and in Puerto Rico and other territories. There are no out-of-pocket expenses for the Survivor program. Once you are evaluated and certified with a WTC-related health condition, medically necessary treatment is billed to your public and/or private health insurance company, and anything that your insurance does not cover is picked up by the program. This includes co-payments, co-insurance, and deductibles for exams, tests, and medications provided through the WTC Health Program. For an application to enroll in the Survivor Program, go to the program website. You can also call 1-888-982-4748 to have an application mailed to you, as well as for any additional information or help you may need. How do you complete the World Trade Center Health Program Responder application? There are 3 steps to apply to the World Trade Center Health Program. Step 1. See if you are eligible. The WTC Health Program serves 4 groups of people affected by the 9/11 attacks: FDNY responders, WTC general responders, WTC survivors, and Pentagon and Shanksville responders. Eligibility criteria for these groups are defined by the James Adroga 9/11 Health and Compensation Act of 2010. You can look on the program website to see if you fit in one of these 4 groups. If you think you are part of one of these groups, then see if you satisfy the activity, location, time period, and hours requirements for your group. Step 2. Review what documentation you will need. You must include supporting documentation that details the activity, location, time period, and hours requirements for your group. Each eligible group has different requirements and types of supporting documentation that can be submitted. Step 3. Complete the application for your group. You can either apply via the program's online system or by downloading a form and submitting it via mail or fax. Let's review completing the General Responder application. Page 1 is name and basic contact information. Page 2 asks where you were and what days and hours in September 2001 you worked or volunteered in a WTC rescue, recovery, debris cleanup, or related services. This should be completed based on your best recollection. Page 3 asks how many hours in October 2001 through July 2002 you worked or volunteered, and asks for required documentation. Documentation may include, but is not limited to, a pay stub, official personnel roster, a written statement signed by an employer under penalty of perjury, site credentials, or similar documentation. Any documentation submitted must show the dates, hours, and locations worked, as well as describe the specific duties performed in response to the 9/11 attacks. If you are unable to submit the required documentation, you must explain how you attempted to obtain this documentation and the reason you are unable to provide it with your application. Page 4 asks questions about whether you have filed for workers' compensation or line-of-duty injury insurance. The WTC Health Program services are provided at no cost to responders. However, this information helps the program plan for coordinating payments with other responsible payers. Lastly, the application asks if you are with a union or other professional association. Page 5 is the last page and requires a signature to complete the application. By signing the application, you are attesting, under penalty of perjury, that you believe you meet the eligibility criteria. Pages 6 through 12 are notices regarding WTC Health Program requirements. Please read through these notices carefully. Your application is now complete. You can submit a paper application in 2 different ways. You can mail it along with your supporting documentation to the WTC Health Program, or you can fax it to the number on your screen. The paper application cannot be submitted by email. If you prefer to submit your application online, along with your supporting documentation and signature page, please visit the website on the screen and fill out the WTC Health Program's online application and signature page. We recommend that you submit your application and supporting documentation at the same time. If you have questions about how to fill out the application, call the WTC Health Program toll-free. The application for Pentagon and Shanksville responders is similar, but has some different questions and different criteria for eligibility. You can find that application on the program's website. How do you complete the World Trade Center Health Program Survivor application? Step 1. See if you are eligible. The WTC Health Program serves 4 groups of people affected by the 9/11 attacks. If you are a survivor, you are part of the WTC survivors, those who lived, worked, or went to school in the New York disaster area. And eligibility criteria for the WTC Health Program are defined by the James Zadroga 9/11 Health and Compensation Act of 2010. You can look on the program website to see if you fit in one of these 4 groups. If you think you are part of one of these groups, in this case a WTC survivor, then see if you satisfy the activity, location, time, and days requirements for your group. Step 2. Review what documentation you will need. You must include supporting documentation that details the activity, location, time period, and days requirements. Each eligible group has different requirements and types of supporting documentation that can be submitted. Step 3. Complete the application for your group. You can either apply online via the program's online system or by downloading a form and submitting it via mail or fax. Let's review the process for completing the paper WTC Survivor application. Page 1 asks for your basic contact information. Page 2 refers to your World Trade Center disaster area experience. The disaster area is anywhere in Lower Manhattan below Houston Street and in the parts of Brooklyn within 1.5 miles of the World Trade Center site, including parts of Brooklyn Heights, Dumbo, and Vinegar Hill. Because the Survivor program is primarily a treatment program, you must have at least one WTC-related physical or mental health symptom or condition to enroll. If you do, check the box and briefly describe the symptom or condition and when it started. If eligible, survivors are enrolled as screening-eligible survivors, but become certified eligible survivors if their initial health evaluation results in being certified with at least one WTC-related health condition. Now, on to your presence in the disaster area. Check the first box if you are present in the New York City disaster area in the dust or dust cloud caused by the collapse of the WTC towers on September 11th. Check the second box if you worked, lived, attended school, childcare, or adult daycare in the disaster area. Then insert the number of days you were there between September 11th, 2001 and January 10th, 2002, and your location at that time. Next, insert the number of days you were in the disaster area from January 11th, 2002 through July 31st, 2002. Now put in the location or address of where you were during that time. If you worked as a cleanup worker or did maintenance work in the area from September 11th, 2001 to January 10th, 2002, check the box. Then fill in the location or the address where you worked. If you lived in the New York City disaster area during the time between September 11th, 2001 and May 31st, 2003, and were deemed eligible to receive a residential grant from the Lower Manhattan Development Corporation, or LMDC, check the box and put in the address and the number of days you were living there. Check the next box if you worked for a company in the disaster area that was deemed eligible to receive grant money from the LMDC or other government programs to help revitalize Lower Manhattan after September 11th. Insert the address of the company. If you are not able to check any of the boxes above, but still believe that you qualify, check the box and write your reason in the space provided. Page 3. Now we'll move on to the required documentation that you must provide with your application. If you worked in the disaster area between September 11, 2001 and July 31, 2002, among the best documents you can include with your application are pay stubs, a letter from your then employer, a letter from a supervisor, coworker, or union. If you are enrolled in the World Trade Center Health Registry, a copy of your registry survey. Any documentation provided must verify the physical work location or address and the date range worked. If you lived in the disaster area, examples of a document to include with your application are a copy of your lease, a letter from building management or your World Trade Center Health Registry survey. Any documentation provided must verify the physical residence location or address and the date range you resided there. For students who went to school in the disaster area between September 11, 2001 and July 31, 2002, the best documents to include with your application are a transcript, a diploma, a photocopy of your student ID, or a letter from your school. Any documentation provided must verify the physical school location or address and the date range you attended school there. If you were present in the NYC disaster area in the dust or dust cloud on September 11, 2001 for any reason, for example if you were shopping or went to a meeting, the best documents to include with your application are any receipt showing the location and date of September 11, 2001, or a written and signed statement from you or someone who was with you with a description of your activities. The statement must describe your physical location or address on September 11, 2001 during the collapse of one or both WTC towers, and should confirm any exposure to the dust or dust cloud that you experienced. If you are unable to submit the required documentation, you must explain how you have attempted to obtain this documentation and the reason you are unable to do so. You will also need to provide a signed written statement that you meet the eligibility requirements and include details about where and why, as well as the time period you were in the disaster area. There is also a voluntary information section where, if you are a member of a union, professional organization, or association, you have the option of listing your membership. Page 4 is simple. You will just sign and date your application. By signing the application, you are attesting, under penalty of perjury, that you believe you meet the eligibility criteria. Pages 5 through 11 are notices regarding WTC Health Program requirements. Please read through these notices carefully. Your application is now complete. You can submit a paper application in two different ways. You can mail it along with your supporting documentation to the WTC Health Program. The address is on the screen. Or you can fax it to the number you see on the screen. The paper application cannot be submitted by email. If you prefer to submit your application online, along with your supporting documentation and signature page, please visit the website you see on the screen to fill out the WTC Health Program's online application. We recommend that you submit your application and supporting documentation at the same time. How does the World Trade Center Health Program deal with workers' compensation for responders and public or private insurance for survivors? Coordination of benefits is a process that helps determine who pays a medical bill first when there is more than one potential payer. Where there are other potential payers, the Zadroga Act requires that the program seek payment from those payers for treatment of a certified WTC-related health condition. For responders, the program directly pays for all monitoring, treatment, and medication costs of a certified WTC-related health condition for responders, with one exception. If a responder has a workers' compensation claim for the certified condition, then workers' compensation is the primary payer, and the program pays the remainder of the costs. However, to facilitate processing in such cases, the program will pay initially and then seek recoupment from either the workers' compensation carrier or settlement where applicable. For survivors, the program directly pays for the one-time initial health evaluation for screening-eligible survivors and for annual monitoring exams for certified eligible survivors. Screening-eligible survivors are enrolled individuals who are entitled to a screening exam, also called an initial health evaluation. Certified eligible survivors are enrolled individuals who have at least one health condition decided by the WTC Health Program to be related to their 9/11 exposures and certified by the program. For treatment and medication costs of a certified WTC-related health condition, the program covers what is left after your primary health insurance pays its share. The program bills your private health insurance first. The program then bills any public health insurance like Medicare or Medicaid you may have. Once your other health insurance providers have paid, the program pays any remaining amount. This leaves no out-of-pocket cost to you. You are not responsible for paying any co-insurance charges, co-payments, or deductibles for care of your certified WTC-related health conditions, as long as that care is received from a program-affiliated provider. Please note that if a survivor's certified condition is work-related and they have a workers' compensation claim for the condition, then workers' compensation is the primary payer. However, to facilitate processing in such workers' compensation cases, the program will pay initially and then seek recoupment from either the workers' compensation carrier or settlement where applicable. Survivors must share their primary health insurance information when visiting all program-affiliated providers. This may include both private and public insurance information. Billing. In most cases, the billing of medical claims for both responders and survivors is handled by the Clinical Center or Nationwide Provider Network, and no action is needed by you. However, survivors that receive treatment through a program-affiliated provider not located at a clinical center should let the provider staff know that the visit is for a certified WTC-related health condition. This will help make sure that the visit is billed properly. For survivors that get medications at a retail pharmacy, please tell your pharmacy to bill your primary insurance first and the WTC health program last. Visit the website on the screen for more information on how to help your pharmacist bill your prescription correctly. If you receive a bill for WTC-related care, please call your clinical center, the Nationwide Provider Network, or the WTC Health Program Call Center as soon as possible so the issue can be addressed. The WTC Health Program does not have the legal authority to directly reimburse members if you pay for services that were mistakenly billed to you instead of the program. So it is essential that you contact your clinical center, the Nationwide Provider Network, or the Program Call Center as soon as you receive a bill for which you think the program is responsible. Where can I find more information on the World Trade Center Health Program? You can get answers to your questions if you call the WTC Health Program Call Center. It's open Monday through Friday from 9 a.m. to 5 p.m. Eastern Time. The call center can answer questions about whether you may be eligible, how to enroll, what the benefits are, and how the program works. Or you can go to the program website.